Hello, and welcome to The Breakdown with Dr. Muni, where you can learn about your body and your health for absolutely free. If you haven't already, go ahead and hit subscribe. Today, we are going to be talking about polio. Most of us younger Americans have never met anyone with polio because of the success of vaccines. Polio is very serious because 1 in 200 infections can actually cause permanent paralysis. Countries at higher risk of polio were generally in Africa, somewhere in Asia, or in the Middle East. With a decrease in vaccination rates in America, polio is likely to make a resurgence. Doctors and healthcare professionals are preparing, so you should be prepared as well. Polio is a highly infectious disease that affects the nerves in your spinal cord and your brainstem, which control muscle movement. In its worst cases, it can lead to paralysis, difficulty breathing, and death. Sorry. It is caused by a virus, but it's different from the viruses that we've already discussed, such as measles and the flu. This virus, named poliovirus, primarily spreads through contact with poop, with contaminated water or contaminated food. It then creates its home and multiplies in your intestines. You can develop polio by not washing your hands when you go to the bathroom or handling poop, i.e., changing diapers, through contaminated drinking water, contaminated swimming water, or being in close contact with somebody who has contracted the polio virus. Polio is most infectious 7 to 10 days before your symptoms begin. Infected people can spread the disease for up to 6 weeks without having any symptoms. The diagnosis of polio is usually made by testing the stool or doing a blood test to check for antibodies. Most people who contract polio virus do not even know it. They're completely asymptomatic. They might have some flu-like symptoms, fever, sore throat, fatigue, nausea, or stomach upset in very mild cases. These symptoms for most people last for 2 to 3 days and then are completely gone. Non-paralytic polio is a bit more serious. The symptoms tend to be a bit more intense. That usually affects about 1% of the people who contract the virus. Non-paralytic polio does have longer lasting symptoms, but does not cause paralysis. You'll have those flu-like symptoms as well, but you'll likely have neck pain, joint stiffness, and a severe headache. You may also begin to feel better within a few days, and then boom, you're hit with a second wave of symptoms. Paralytic polio is the most serious complication of this disease. This is marked by extreme pain and sensitivity to touch, as well as a pins and needles type of feeling. You know that feeling that you have when your hand falls asleep if you sleep on it wrong? That pins and needles type of feeling. Likely in paralytic polio, you will have muscle weakness that progresses to complete paralysis. This usually begins in one arm and then affects one leg, but can affect any of your joints. Oftentimes, this paralysis happens within hours and sometimes is permanent. President Franklin Roosevelt, as well as artist Frida Kahlo, were two prominent historical figures that both suffered and struggled with long-term effects of polio. Post-polio syndrome is one of the very common post-viral syndromes that can lead to long-term disability from a result of having this virus. This post-viral syndrome can actually appear decades after you've cleared the virus from your intestines. This is one of many post-viral conditions that shows that just because you originally recover from a viral infection does not mean there are not long-term consequences and long-term side effects. Important to know, there are no treatments for polio. Most doctors, like myself, frankly, would not even know what to do if a patient with polio came into their clinic or into their emergency room. Modern treatments involve over-the-counter pain medications to try and decrease the discomfort in your muscles, but really we'd just be guessing. Really, all we could do is long-term physical therapy, occupational therapy, or send you to rehab if you do end up with muscular involvement from polio or with any neurological complications. Respiratory support will likely be required if you develop paralytic polio because the muscles required for you to inhale and exhale will be paralyzed. Look up a photo of an iron lung and you'll see what I mean. Childhood polio vaccines have gotten rid of most of the infections that we see in the United States. It's important to know, just like other viruses, vaccination will prevent the majority of cases. It is not necessary for us to talk about patients potentially becoming paralyzed from something that you can prevent. Prior to this vaccine, this virus paralyzed thousands of children and adults per year. The CDC recommends 4 different doses of IPV vaccine. However, if you are somebody who has changed your mind about vaccinations, it's important to note that you can still get the polio vaccine as an adult. If you are traveling somewhere, even within the United States, where you think that you are going to be exposed to polio, please speak with a primary care doctor in person or via telehealth so that you can make sure you are vaccinated or getting your booster for polio. Now, this is one of many viruses that are expected to make a resurgence in the coming years because of decreased vaccination rates and decreased interactions from patients with the healthcare system. It's very important for me to continue making these videos because if I didn't know how to recognize what polio was in patients, you definitely wouldn't be able to recognize it for your family. If we are going to be dealing with things that were previously eradicated or previously inactive in the States, we all have to educate ourselves to do our part and recognize the signs before it's too late. We don't want any more paralyzed babies, okay? Thank you for tuning in. If there's any topics that you want to learn about, please drop it in the comments below. Until next time, this is Dr. Muni with The Breakdown.